Hello everyone and welcome to my channel. I'm Gwendolyn Halle, a seasoned medical professional, and I'm here to bring you the juice. Today we'll be talking about penile yeast infections. And if you're a returning subscriber, this is me saying thank you. Don't forget to turn on the notification bells. When I drop a juicy video like this, you'll be the first to watch. And if you just stumbled on this channel, subscribe, like and share, and join the family. I love you. Let's roll in. Welcome back. Into this class, we are going to be talking about yeast infection in men, penile yeast infection. Now, it's commonly spoken of yeast infection in women, but people rarely speak about yeast infection in men. We'll be tackling the causes, the symptoms, the treatment, and the prevention in this video. So brace yourself. Firstly, I want to say that this yeast infection is caused by the fungi Candida albicans. There are several causes of penile yeast infection, and the first is taking antibiotics for a long period of time. Second is wearing damp underwear. Third is wearing dirty underwear. Fourth is if the male has an autoimmune disease. That means that his immune system is weakened and he's exposed to a lot of infections. He can easily get penile yeast infection. The fifth is oral sex, fellatio. If a woman has oral candida and she's giving you a blowjob, you have a high chance of having penile yeast infection. The next point is poor hygiene. If you don't wash your manhood properly, you are exposed to penile yeast infection. And also, those who are uncircumcised, the accumulation of dead cells, sweat, and microorganisms under the foreskin will cause smegma. And if smegma is not cleaned or washed off very often, or if that area is not washed off properly, it may lead to balanitis. And in the long term, it may lead to penile cancer. And your manhood or your penis could be amputated. The next point is if you carry out anal or vaginal sex with someone who is infected, you have a high chance of having penile yeast infection. Somebody can have yeast infections in their anal passage, and a woman can have a yeast infection in her vagina. It's very easy for you to pick up this microorganism. And the last point, the last cause of penile yeast infection is using unlubricated condoms. Symptoms of penile yeast infection or yeast infection in men. Point number one, pain during sex, pain during ejaculation, pain while urinating, a discharge, a thick kind of cottage cheese discharge or ejaculate, and sometimes it's not off-white as it used to. You also have rashes. You could also have rashes on your penis. You could also have soreness, especially around the tip of your penis. And in some people, especially those who are uncircumcised, they can have cracks at the tip of their penis. And lastly, white patches at the tip of the penis. So how can we treat penile yeast infection? How can we treat yeast infection in men? It's by going to the hospital, and then a swab test will be done, or let me say your ejaculate will be collected and it will be cultured. An antifungigram will be done, and then the doctor will decide which fungi drug is sensitive. And that is how you're going to be prescribed a drug to take, an antifungal drug to take. It is very important that an antifungigram to be done so that the right fungi drug should be determined, so that your treatment is effective. And it's important that you take the treatment for the length of time as prescribed by the doctor, even when you feel better. Trust me, fungal infections are so stubborn. This will help so that you don't get recurrent yeast infection. So when you treat it for the prescribed period of time. You could be prescribed fluconazole, ketoconazole, there are creams, there are ointments, but for an effective treatment, it's good to take tablets. How can we prevent penile yeast infection or yeast infection in men? Point number one, wear clean underwear. Secondly, don't wear damp underwear. Thirdly, use condoms. Don't have unprotected sex. Don't have unprotected sex. And if you are uncircumcised, see if you can get circumcised. Some doctors are going to recommend circumcision for people who have recurrent yeast infection. Next point, good hygiene. Wash your manhood properly. Wash your penis properly. The next point is avoid oral sex. Avoid anal sex. Avoid any form of, mode of sexual intimacy that can cause microorganisms to be transmitted to you. And the last point on our list is if you're married, make sure that you do regular checkups. You may have one partner, but as you can see from the causes, you can have these penile yeast infections or this penile yeast infection or yeast infections even just from taking antibiotics, even just from having an autoimmune disease, from your lifestyle, from poor hygiene. So it is important that we actually test ourselves regularly, whether you are married or not, at least 4 times in a year. Go for your routine checkups and I tell you, you're going to stay healthy. So thank you very much for joining me in today's class. I remain your seasoned medical professional, Gwendolyn Halle. Bye-bye.